One of the things I find interesting about these kind of questions of public health is we're completely inconsistent on them as a country. So the government has been completely inconsistent. So you get this sort of idea of a meat tax, and this is sort of panic, and this is the worst idea ever, and everyone's being mocked for it. And then you also have the government trying to completely ban smoking. I mean, on one hand, it's nanny state. On the other hand, it's a sensible and the right approach. And they seem to have taken both approaches simultaneously on different issues. Is there any way we could just sort of have a better framework almost for thinking about what is the state's job when it comes to public health? What is acceptable? And how do you get public consent for those things to show that it is actually something that people want, rather than endlessly being stuck in nanny state versus libertarian arguments every time we go around one of these discussions?
Yeah, I mean, look, I should be clear. I run a charity, and we are responding to and engaging with all the political parties. We're talking today about Labour because of the fact that Wes Streeting's been talking about his policy, and also because the polls suggest that there will be a Labour government. So I just want to kind of emphasise to emphasise that. I do think, however, that you're right in the sense that it has felt for this government, potentially because of its ideological position, it has often felt conflicted between, in a sense, the duty of kind of public care and responsibility and the need to do things which reduce burdens on the state and the taxpayer, and that kind of more libertarian dislike of nanny state, and that has led to inconsistency. I suspect Labour will be less, if Labour wins, they'll be less affected by that. I think they will probably feel more unapologetic about, and Wes Streeting has indeed said, hasn't he, that he's not afraid of being referred to as the nanny state. I think an important part of this, however, is the way you articulate the narrative. I know that I was in number 10 when we introduced the ban on smoking in public places, and it was absolutely clear to me the critical thing there was the evidence for passive smoking. The point at which you could say, look, it's up to you if you want to kill yourself, but you can't kill other people, was a critical moment in terms of shifting the public view of that issue. And that's why that change could happen. So the way you construct this narrative is important. And part of that narrative, I think, is about the impact on the economy of the state of public health. And I think that's something that a government that is deeply committed to growth, what is the number one thing that Labour talks about every single day is growth? Well, it is clear that one of the things that's holding back growth is the health of the population and the access to health and care services that they have. And that, I know, is one of the things I'll be listening out for in terms of, if Labour does win the election, in terms of what Rachel Reeves says, is are we going to see a greater recognition of the interdependence between health and the economy?
Yeah, I think that's such an important point. I mean, something I've often wondered about as well. You mentioned kind of activity at school, but I often wonder if more should be made of a partnership with employers as well, about how employers have got skin in the game in terms of their workforce being healthy. Should employers be incentivized or persuaded or encouraged to offer sort of more healthy living to their employees, whether it's exercise classes or, healthy food? What do you think about that?
Yeah, I think with large employers, you're pushing an open door, and I certainly think more can be done there. There's a large retailer, for example, that gives its staff time off for cancer checks. So there is quite a lot of this stuff happening, and actually, my organisation, the Confederation, is exploring more how we can work with businesses. The challenge, as you know, in these areas is always small and medium-sized businesses that don't have so much capacity, the tighter margins. So, you need to make sure that you're not just doing this with big employers that care a lot about their reputation, have got economies of scale, but what can you do for the rest of the economy, for people? I mean, including, of course, people working in areas like social care, where you're working in you're working in low wage areas, quite atomized in terms of employment. So yes, I do think there's a lot more employers can do. I think large employers want to do more, and some of them already are, but we do need to think about what we do for all of the workforce.
Also, I'd argue the NHS as an employer itself. I mean, my father was in hospital recently and the nurses did an amazing job, but I was struck looking around. People did not look healthy. A lot of the nurses and people working in the NHS, they looked like there was a lot of health problems going on as well.
Yeah, and a lot of health leaders do things which are there. I mean, a lot of things which are there to support the physical and mental well-being of their staff. But this is a staff that have been through COVID. This is a staff that is facing unprecedented levels of demand. This is a staff that isn't able to deliver levels of care which everybody recognises we would want to deliver, whether that's people being seen within 4 hours in accident emergency departments or, people on waiting lists. So I think we are going to have to get into a slightly more hopeful position in the health service. And I think at the moment, for many NHS leaders, if they felt as though they were kind of lecturing their staff about their waistlines or whatever, I think their staff would say, well, look, first of all, can you give me a job which doesn't involve me going home in tears because the pressures are too great? So we do need to get into a slightly more positive mindset, I think. But of course, you're right. I mean, we would want people who work in the health service to exemplify our commitment to health and well-being.